Okay. So last few topics in orthopedics. That is metabolic bone disorders. Metabolic bone disorders. Okay. So when we talk about metabolic bone disorders, you must know the action of few chemicals in our body. So one is calcitonin, another one is parathormone, and another one is vitamin D. We'll just see what these materials do on our body, and then we'll move to the disorders. See, as we all know, calcitonin decreases the blood calcium level. The calcitonin decreases the blood calcium level. It moves the calcium to bone. It moves the calcium to bone. Okay, so thereby it decreases the blood calcium level. What does parathormone do? Parathormone increases the blood calcium level. Parathormone increases the blood calcium level. How does it do? It increases the blood calcium level by acting on bones. So from the bone, calcium is released. From the bones, calcium is released. It acts on the kidney and causes calcium reabsorption. And it causes calcium reabsorption. Okay. So for the people who have arrived now, so we are talking about a few hormones in the body. One is calcitonin. Calcitonin usually decreases the blood calcium level. If blood calcium is more, calcitonin is released and it moves the calcium into the bone. Thereby it decreases the blood calcium level. Parathormone, on the contrary, it increases the blood calcium level. How it increases the blood calcium level? Bone is considered as the storehouse of calcium. You all know bone is storehouse of calcium. What is storehouse of glycogen? Liver. Storehouse of glycogen is liver. So storehouse of calcium is bone. So what parathormone do is it acts on the bone and it increases the blood calcium by releasing the calcium from the bone. It also acts on the kidney and causes calcium reabsorption. It acts on the kidney and it increases phosphate excretion. It increases the phosphate excretion. It increases the phosphate excretion. Okay. So next hormone which you are seeing is vitamin D. Okay. Vitamin D is produced in the skin in an inactive form called hydrocolsyferol. Or yes, it is produced in the skin in the form of cholecalciferol. The vitamin D reaches the liver where 25 hydroxylase enzyme acts and converts it into 25 hydroxycholecalciferol and converts it into 25 hydroxycholecalciferol. See, this cholecalciferol is an inactive form. 25 hydroxycholecalciferol is also an inactive form. This inactive form in the kidney acted upon by 1-alpha hydroxylase and converts it into 125 dihydroxycholecalciferol. So this dihydroxycholecalciferol is an active form. This is also called as vitamin D3. This is also called as vitamin D3. So vitamin D3 is the active form. It is also called as 1,25 dihydroxycholecalciferol. Now what does vitamin D do? It do two things. One, it acts on the intestine. And causes calcium absorption. and causes calcium absorption. It also causes phosphate absorption. It also causes phosphate absorption. Whereas it acts on the kidney, it causes calcium reabsorption, and phosphate excretion. All these are very, very important points. Only when you understand how they act, then you can understand the pathology behind them. So we'll just revise the action of these three hormones. What does calcitonin do? Calcitonin decreases the blood calcium level. It moves the calcium to the bone. So calcium in the blood will be decreased if calcitonin is released. Parathormone is opposite to that. It increases the blood calcium level. How it increases the blood calcium level? It acts on the bone. It dissolves the bone. So when bone is dissolved, calcium is released into the bloodstream. So blood calcium increases. It also acts on the kidney and causes calcium reabsorption. So in a similar way, vitamin D, when it becomes active, it acts on the intestine and causes calcium absorption and phosphate absorption. On the kidney, it causes calcium reabsorption but phosphate excretion. It causes phosphate excretion in the kidney. So these are three important hormones which act around the calcium metabolism. So there is an entity called as rickets. And there is another entity called as osteomalacia. Both are same, but the age group in which they happen is different. Rickets occurs in children and osteomalacia occurs in adults. Both are because of vitamin D deficiency. Okay. So rickets is also osteomalacia is also, both are because of vitamin D deficiency, but only the age group in which they occur, the name is different. Now, when vitamin D is deficient, what happens? Calcium level will be low in the body. Because of this low calcium level, bone growth is affected. How bone growth is affected? You all know, in the epiphyseal region, you get an epiphyseal plate. If vitamin D is not there, if calcium deposition is not proper, the metaphyseal junction widens like this. This is called as cupping of metaphyses. So in rickets, the patient will present with cupping of metaphyses because calcium deposition is not happening. Only when calcium deposition happens, the bone will be strengthened and it won't splay. Here splaying or cupping happens. So you will see this sign in an X-ray of a patient affected by vitamin D deficiency, that is in rickets. The patient will also have poor abdominal muscle tone, leading to pot belly. There will be thickening of the costochondral junctions. Gets thickened, resulting in ricket rosary. Because of the weak ribs, full of diaphragm causes sulcus below the costal margin, which is called as Harrison's sulcus. Because of the vitamin D deficiency, the bones are weak, and the weight-bearing joint, especially the knee joint, will go in for genu varum deformity bilaterally. It can also go in for genu valgum deformity, or it can also go in for wind-swept deformity. So these deformities can arise because of vitamin D deficiency. These can arise because of vitamin D deficiency. So, in vitamin D deficiency, splaying or cupping of metaphysis can happen, pot belly can occur, ricket rosary can occur, Harrison sulcus can occur, genu valgum or genu varum deformity can occur in rickets. So, if you see this diagram, you can understand the child's knee is like this. This is genu varum deformity. This is genu varum deformity. If the knee is like this, it is called as genu valgum deformity. It's called as genu valgum deformity. That can also occur in rickets. That can also occur in rickets. The child will also have this kind of chest. The sternum will be pushed forwards. This is called as Pigeon chest. This is called as Pigeon chest, also called as pectus carinatum. This is 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 an X-ray of a child with rickets, where you can see the metaphyseal region splayed out like this. So this is called as splaying of metaphysis. This is called as splaying or cupping of metaphysis. You can see the metaphysis is getting cupped like this. This is called as splaying or cupping of metaphysis. All these are signs of rickets. All these are signs of rickets. In adults, those who are having vitamin D deficiency, the condition is called as what? This condition is called as osteomalacia. This condition is called as osteomalacia. In osteomalacia, the adult will have widened pelvis, which is called as trefoil pelvis. Which is called as trefoil pelvis. They can present with fish mouth vertebra. They can present with fish mouth vertebra. They can present with fish mouth vertebra. They can present with kyphotic deformity of the spine. They can present with kyphotic deformity of the spine. They can present with fractures, stress fractures in the bones, which are called as Looser's zone. So Looser's zone can be seen in adult patients who are suffering from osteomalacia. So in vitamin D deficiency, the treatment is very simple. If you find out that the patient is suffering from vitamin D deficiency, you treat him with vitamin D. You give 50,000 to 60,000 international units of vitamin D per week for 12 weeks. So you give vitamin D supplements at a rate of 50,000 to 60,000 international units per week for 12 weeks, and this regimen is called as STOS regimen. This regimen is called as STOS regimen. This regimen is called as STOS regimen. So that is how you treat vitamin D deficiency, by using this method. Okay, fine. So what is vitamin D deficiency? The vitamin D deficiency, when it occurs, calcium level in the body is low. Because of that, all this problem is occurring. Scurvy. What happens in scurvy? See, scurvy is because of vitamin C deficiency. Scurvy is because of vitamin C deficiency. Vitamin C deficiency. Okay. What is the use of vitamin C? Vitamin C converts the pro-collagen into collagen. Collagen is in triple helix structure. Collagen is a triple helix structure. It is in the form of triple helix. You see the collagen, this will be one strand, this will be the other strand, and you will have three strands like this. So it is a triple helix structure. So pro-collagen has to be converted into collagen like this. It requires vitamin C. It requires vitamin C. If collagen formation is not happening properly, yesterday we saw bone has got two types of matrix. One is organic matrix, another one is inorganic matrix. In inorganic matrix, we saw there is a substance called as ground substance which contains collagen. So bone has got one important component which is made up of collagen. If collagen is not formed properly, bone growth will be affected again. Bone growth will be affected. There will be sufficient calcium, but there won't be sufficient collagen to absorb the calcium. So the problem here is collagen defect. So because of this, what happens is there will be calcification of the epiphyseal plate. There will be calcification of the epiphyseal plate, which results in a line called as white line of Frankel. White line of Frankel, and the epiphyseal plate extends beyond the metaphysis, forming Falcon spurs. Because of the collagen defect, the blood vessels are weak, resulting in subperiosteal hemorrhage. Blood vessels are weak, resulting in subperiosteal hemorrhage. The epiphysis will present with a rim of sclerosis. Epiphysis will have rim of sclerotic bone, and that sign is called as Wimberger's sign. So all these signs are seen in scurvy. You will see Wimberger sign, you will see subperiosteal hemorrhage, you will see Falcon spur, and you can see white line of Frankel also. Okay, so we'll see all this in this X-ray. Okay, so you can see the periosteum is lifted here and hemorrhage has happened. So this hemorrhage is called as what? Subperiosteal hemorrhage. Because when collagen is not there, see, you know, blood vessel is made up of 3 layers. You know, layers of blood vessels. What is the innermost layer of blood vessel called? Tunica intima. Then you got tunica media. Then you got tunica adventitia. So in tunica intima, there is a membrane called as basement membrane, and that basement membrane is made up of collagen. If that collagen is not proper formally, so the endothelium gets weakened, blood will come out of the blood vessels. So that causes these kind of hemorrhages. So in the bone, you will have subperiosteal hemorrhages. You can see the epiphyseal plate getting thickened like this. So this is called as white line of Frankel. And that epiphysis extends beyond the metaphysis. This is metaphyseal region. You can see the epiphysis is coming beyond the metaphysis. So that is called as Falcon spur. And you can see a rim of calcification around the epiphysis, and that is called as Wimberger's sign. All these features are seen in scurvy. Okay. So whenever you diagnose a patient with a scurvy, you treat him by giving vitamin C supplementation. Very simple. You give him vitamin C supplementation, the condition will be corrected. So vitamin C supplementation is needed. Here. Okay.